Welcome, everyone. I'm really glad everyone is able to join us here live. Our presentation today is about COVID-19 and dealing with infertility and pregnancy planning. Our goal is really, we recognize that the situation is changing on the ground and that certainty in these times is really not possible. And it's adding to the confusion and stress that's happening. So what we're going to talk about today is just based on what we know now, recognizing we need to balance things happening in public health, what the individual needs are for everyone facing infertility and dealing with planning pregnancy, and also things like what makes something an urgent or non-urgent need and what and how does that translate. We're not here to provide answers, and just to let everyone know, this is not the time to ask for medical advice or therapy, but what we are going to be able to do is provide some understanding of the situation right now, to lay out the issues that are involved, identify what is important to consider when making decisions, both medically and emotionally, and to consider how we take care of ourselves through all of that. So with us today, and I apologize, I forgot to introduce myself. I am Rabbi Idit Solomon, the founder and CEO of Hasidah. We are the Jewish infertility support organization, and we're really proud to be able to have Dr. Peter Klatsky and Karen Erlichman with us today as our presenters. Dr. Peter Klatsky is he is a board certified both in obstetrics and gynecology and reproductive endocrinology and infertility. He is one of the founders of Spring Fertility, and he will be speaking us today from the medical perspective. And, Karen Erlichman is a licensed clinical social worker. She provides psychotherapy and spiritual direction. And she has also been on the faculty of UCSF, University of California, San Francisco, in the OB/GYN and Reproductive Sciences. So they will be addressing today what we'll be doing. And one of the things that I just want to share before I hand this off is part of the reason that this came up was because the ASRM, the American Society for Reproductive Medicine, recently issued a recommendation to say, for clinics to suspend new IVF or IUI cycles and different procedures and to consider canceling embryo transfers and different things about limiting care and minimizing in-person interactions. And we recognize that both medically and emotionally that has really huge effects on us and what we're doing. So we're going to address that today. So with that, I'm going to hand this over to Dr. Peter Klatsky to share with us a little about the medical side of this. One moment, I'm unmuting you. You're muted.
Got it. Sorry. Hi there. Called in between. Can you hear me now? See me now? Hi, sorry about that. Can you hear me now? So it's a frightening and anxious time for everybody. This new virus that mutated such that we have no immunity to it is sweeping the globe rapidly. Most people who have it don't experience symptoms, and as such, it's been able to spread with tremendous rapidity. Fortunately, it does not adversely affect women of reproductive age or newborns or children. In fact, childhood cases have rarely been reported. There was a newborn recently that was infected after birth and made a full recovery. The data look far worse for patients over 65 and specifically over 80, where the mortality has ranged from 8 to 15%. The other group that is adversely affected are people with comorbid illnesses. And in the United States, we're seeing a lot of hospitalizations in people between 40 and 65 as well. Overall, the case fatality rate is much lower in populations under 70, around 1%. There's 2 reports that describe 18 pregnancies with COVID-19, now called SARS-2. All those patients were infected in their 3rd trimester. Clinical findings were not different from those in non-pregnant adults. Typically, women who are pregnant have a harder course with various illnesses. But in this case, it does not appear different for women who are pregnant versus or not, although all of the cases we're aware of occurred in the 3rd trimester. None of the cases reported any virus detectable in the placenta or in the babies that were tested. So there does not appear to be transmission through the placenta. That's the good news. We have no data on 1st trimester pregnancy outcomes, and however, nobody has said that people should stop trying to get pregnant. The American Society for Reproductive Medicine did issue a recommendation to temporarily stop frozen embryo transfers, fresh transfers, and IUI procedures. The thought process there was more about strain on our healthcare system and less on any evidence of overall harm to women who are pregnant or to their fetus. It is worth noting that COVID-19, now called SARS-2 or SARS-2, is a strain similar to the original SARS virus. And in that one, there were 7 first trimester infections, 4 of which ended in a spontaneous abortion. It was also associated with more preterm delivery. But those were all very few cases. There were only 7 first trimester infections reported, and fewer women in their 3rd trimester, only 5 women in their 3rd trimester. So still very little data, but virus is a virus that affects the upper respiratory system and does not tend to disseminate through the bloodstream, and it does not locate in the placenta. So my overall guidance to patients is that it's not an indication to stop trying to conceive naturally. As a community, we're trying to put less stress on our healthcare systems, and as such, we are all following the guidance to slow or stop new cycle starts, particularly in cities and regions that have been hard hit by this, such as San Francisco. We recently decided to stop all cycles that have not been initiated and just finish up the cycles, the stimulation cycles that are currently underway. Any patient who has a fever or symptoms would be canceled immediately. And that's the medical situation.
Thank you very much for that overview. We are now going to switch to Karen to share with us a little bit about what are some of the I'm sorry, I'm losing my thought. Some of the things to consider as we're going through this, and maybe how we can take care of ourselves through all of this. Karen?
Thank you. I know that for women and couples who are going through this process even prior to COVID-19 or SARS-2, you have already, I'll speak to our participants directly, been through so much prior to the onset of this pandemic. Whatever your own personal journey has been that has gotten you to this point now. And so this is actually a lot to handle. The uncertainty that you've gone through just in your own fertility journey, and now with this global pandemic, there's an added layer of uncertainty, of anxiety for people who've had pregnancy. Are you all having a hard time hearing me? Oh, I can't hear you at all, Edie.
Sorry, I muted myself. It's a little scratchy.
Okay. Is this better? Can you hear me now a little better?
That is better.
Okay. I think my microphone was tucked behind me by mistake. Sorry about that.
Yeah, I think the microphone is rubbing on something.
Okay. So given that there's already been whatever has already gotten you to this place in your fertility journey to now in this time of global pandemic, there is added anxiety and added uncertainty. And for some people, it's there's been trauma. You've had losses and disappointments and challenges in navigating the healthcare system and challenges with your own body and the stress that you have endured up until this point. And so it's very easy for me to say, or for us to say, it's so important to take care of yourselves. And I would imagine that all of you know that. I certainly know that. And yet it's very hard when we don't know when or how this is going to resolve. One of the things I've thought a lot about is how we navigate and how you navigate the passage of time, right? There's the marking of time involved in menstrual cycles, in preparation for medication, retrieval, transfer. Are you still having a hard time hearing me? Okay. If I hold it like this, is that better? Okay. Apologies for that. And so it's extremely important to have a place to talk this out, to think it through together, to sort it out, certainly with your own healthcare provider, whether you have a mental health professional in your life now, a supportive friend or colleague, but so that you don't feel like you're holding all of it in by yourself, having to figure it out on your own. It's totally normal to be feeling this sense of unease and uncertainty, and maybe some grief and disappointment as well. The guidelines that Dr. Klatsky outlined are reassuring in some ways, but disconcerting in others, like reducing the strain on the healthcare system in anticipation of what might be to come is something that I think we all care about. And yet, each one of you has your own way that you're personally impacted by that. And so to have to continue to wait in this unknown way can be very, very difficult. So there are actually some specific tools. We don't have time for them today, but there are some specific practices that help to calm your nervous system, to help you feel more grounded, to help you manage the emotional roller coaster that's a part of this fertility journey anyway, and just amplified by this current pandemic. So all of those tools and practices are even more important. It's not that helpful when people say things like, well, you just need to relax, or you need to take better care of yourself, or you kind of hear that I'm saying it with that kind of urgency, so that you don't have to carry all of that by yourself. You know, that people like Hasidah and Dr. Klatsky and I and others are here to really be with you in this, particularly at a time when we're physically distancing from each other, that we don't have to be interpersonally distant from each other.
Okay, right when I muted myself, I realized you were done. Because I'm thinking that's your ending. Okay, great. I didn't get any, it looks like someone was trying to send a question in. I'm gonna how do I get my video again? Okay. So we do have a question or not. Let's see. Okay. So we have someone on the line here who's looking to start IVF in May, and they want to know if there's an okay enough time during all of this to start. I'm not sure how to read the question. I think most of us here will end up going through this while COVID-19 is still out and about. I want to know if might be an okay enough time.
I think May would be fine. This is Dr. Klatsky responding. I think, but we don't know that yet. I think we'll have to wait and see how the next 4 weeks pan out. But I hope that our interventions are successful at leveling out the rate of transmission. And, we should keep in mind that it's very likely that at least half the people on this call will be infected over the next 18 months. Most of us, it will be mild. We may not even know that we were infected. But I believe that the big stress now is the massive number of new infections, particularly in the elderly. And so the big concern I have as a provider with people getting pregnant is if they have a complication in their pregnancy, will there be resources to assist them? And so that's where I think we should take a wait and see approach for the next month and see what happens.
That makes sense. We have some people who are curious, Karen, when you said you have some of these tools, and I'm not sure you can share them now or give an outline or if there's a way that people can learn more about them, but we have several questions about those tools.
Sure. So the paradigm that I use in the work that I do is very much of a mind, body, spirit, holistic approach. And so, as I would imagine that most of you know, emotions have a very physical and physiological component to them. And it's pretty hard, if not impossible, to will ourselves to not be anxious or to will ourselves to not be fearful. But what we do have some control over actually is the physical experience of those emotions. That I'll just use anxiety as an example, or uncertainty. There's a very physiological piece to that. Some people tremble, some people, their heart will be racing, they'll be sweating. There can be kind of nervous physical energy. And so whatever practices you have for yourself, whether that's exercise or meditation or deep breathing, just the things that are already familiar to you, to lean into those as much as you can. I'll give you one super simple, it's almost going to seem overly simple, but it works very well to help calm the nervous system response. And that is to simply, we can even do it together right now. I don't know, Dr. Klatsky, if there's any data about the about this particular practice. It was certainly taught to me in training I have around working with trauma, but simply to put your hand on your forehead, and as you're kind of leaning in, you're just kind of pressing your forehead to your hand so that you can feel that contact, and almost like you're breathing into that place where your hand and your forehead meet. And you can just take a moment to do that and to really feel it all the way down through your neck and your torso and down through your pelvis and your legs and down to your feet. And so I'm giving you a very abbreviated version of what's usually a longer guided practice, but very simple things that you can do that are to really help to give you a sense of ease and comfort in the physiological experience of these uncomfortable emotions.
That was actually quite beautiful. I was following along with you. I was actually thinking about something that happened to me today, and I realized that when it did happen, a lot of people have that, you put your, like this.
Exactly. There's a reason that there's an emoji for this.
It was really amazing, because when I was following along with you, I thought, oh my gosh, I remember when I did it, the person was like, are you okay? And I thought, this is, this is helpful to me.
Self-soothing.
Out of here. So it's amazingly simple. And I realized, I think we have some of this in our nature, but if you think about it as a positive and a good thing, it's much more opening. Someone wrote in about learning something about holding on to your heart as a DBT skill.
Yes, so in dialectical behavioral therapy and DBT, and also there's something called mindful self-compassion that is taking the tools of mindfulness and mindfulness-based stress reduction and blending them with the practice, applying compassion to ourselves. And one of the things they talk about, Chris Garmer and Kristen Neff, is something called affectionate breathing. And it's where you literally like put your hand to your heart and you're breathing mindfully yourself, and offering that affection and compassion, like, I'm doing the best I can right now. We are doing the best we can right now. But there's the piece of feeling your hand on your heart as you're having that thought or saying it to yourself. thank you to that person for mentioning DBT. It's incredibly helpful with emotional regulation.
This does feel good. These are great techniques. So I have, thank you. I have one other question, and this may vary per clinic, but the question is about someone in a donor cycle, and does this affect donors, someone who may be doing that, the same as someone who is individually going? Is there any distinction made in that regard that we know of for those recommendations? And again, we know clinics may respond differently to this.
Sure. Any clinic currently following ASRM guidelines would not be starting a donor cycle. Even clinics who've chosen not to follow the guidelines and continue with their cycles, the ones that I'm aware of have all stopped any new third-party cases.
But a donor cycle in process would still be able to continue. It's not.
I would ask your clinic. It would vary by clinic, but in most cases, the clinics are permitting them to persist, to continue.
Okay. That's what I think the question is about. Yeah, someone is in cycle. Are they making distinctions, or did the recommendations distinguish between donor cycles and process versus self?
No, I think most of us feel that there's a harm to a patient and certainly to a donor of starting medications and then stopping them.
Yeah.
And so, the way most of us have interpreted those guidelines is that we can complete any cycle that has been initiated, but that it was advised that we not start new cycles at this time.
Makes sense.
I think that will depend based on geography as well.
That makes sense as well. Great. Let me see if I see any other questions here. Whoops. Another question we have is that the same for someone who is in an egg freezing process? Is that considered the same?
I think it depends on every clinic's interpretation, but for the most part, if somebody has initiated treatment and is taking injectable medicines, unless there's a regulatory body that is actively closing down and removing regulatory authority for the surgery center where the procedure will be done, then they are continuing.
Okay. So to me, if I'm understanding correctly, basically the distinction is cycles that have started can continue, and it's not a distinction of what type it is. It's that cycle and process can continue, nothing new.
That's what the ASRM guidelines seem to indicate. But again, this may differ by geography, region, and center. Okay,
that makes sense. Let's see if there are any other questions here. Again, we got that one coming in. Let me see about this one. I think you kind of answered that already. No, I think you kind of answered that. I guess the only thing left in here, is there anything for someone who is in cycle that they should be considering that might make this different? Or things for them, is there anything for someone who is in cycle that they might need to know?
No, I would be pretty reassuring that that this does not affect the eggs or egg quality, and that this is predominantly a health crisis for our community, but not a reproductive health crisis per se, in particular. Okay.
And then I think this is someone's asking about cost, but I think that's kind of a general question across the board about, and that's going to be an individual clinic question about when we're having to not continue with cycles and whatnot. I guess we can all just accept that the billing for this is going to be complicated.
In our case, we committed to all of our patients that if they initiated a cycle and it was canceled because of this, that they would get a full credit for a subsequent cycle, and that they would not be charged for their medical expenses. And we have a good relationship with our pharmacy, and we've encouraged them to take the same position with regard to the medications.
That's very comforting to hear. I hope other clinics follow suit with that. Any other last questions? I've finished all the questions that have come into me. I'm not seeing any others. So with that then, I do want to send a very special thank you to Karen, thank you very much, and Dr. Peter Klatsky. Really appreciate your being able to present here. And again, this is sponsored by Hasidah. Thank you both for coming. Thank you to the people who are able to come and listen to questions, because as I shared, this will be, we recorded this because others may be able to benefit from questions and clarify. And anything else during this time, feel free to reach out to all of us at Hasidah. And we're wishing you all safe and much sanity during these very interesting socially distant. Thank you all again very much.
Make sure your parents stay inside. And grandparents.
Yes.
Take care.
Thanks, everyone.
Thanks.
Bye.